got 22 of us in the call, so we may have a couple of others join, but Caroline or Mike will allow them to come in. We normally have, for these meetings, we normally have a project update from myself at the beginning. Because we've got two speakers with us today, I'm actually going to go at the end of the session when I know how much time I've got to talk, because I've got a few bits that it would be great to update you guys on. But I want to make sure that both Liz and Addy have the opportunity to give us the full sense of their presentation and share with us all of the valuable information they have. So I am going to go straight into handover, and we didn't discuss who would go first, but I think it's probably more fitting, Liz, if you're happy to go first. So Liz Carter, I mentioned a minute ago, is Senior Partnerships Manager for West Sussex NHS, and she's going to give us an overview of NHS Sussex and also the ways in which they are supporting carers. So Liz, I will mute myself. I know you're going to add the presentation from your end, but I do have it on my desktop in case we have any issues. All right, so I'll mute myself and pop you.
That's lovely, thanks. Good morning, everybody. Thanks, Anna. It's going to start with a bit of a caveat. So I'm standing in for Jane Lodge, who is our director of, I can't remember her full title, patient engagement, public involvement, all of that side of things. And she is the expert on this area. So Jane and I spoke last week about the presentation. So although I will happily take any questions. I'm just going to have that moment of please forgive me if I don't know the answers, but we can come back to that. The presentation I'm happy to share afterwards. I've just put together some, the outline is going to be very much there's going to be a bit about structures. So please forgive me if you already know it, but there is about trying to work out who's what when we talk about ICSs, ICPs, ICBs, all of that. And then actually what we do across the ICS sort of in partnership to support carers. Okay, I'm going to share my screen. I think when I do this, I then can't see anybody. So if Anna or Caroline, can you just shout at me if something doesn't really work? Because otherwise it takes up both of my screens and now I can't see. Bear with, here we go. Okay, oh, actually, Anna, I can see you. So there you go. You're going to be the one. Okay. Okay, so we start off with NHS Sussex is the Integrated Care Board, it's the ICP. So the main aim of the ICB is about the strategic priorities and allocating funding for all NHS organisations. And we've got about 1.7 million people that live in this whole Sussex area. For those of you who've been around for a while, this takes on really the responsibilities of the old clinical commissioning groups. And in West Sussex, we used to have Coastal CCG and Crawley and Horsham and Mid Sussex. All of that came together to NHS West Sussex. And then since 2022, we've joined together with West Sussex, East Sussex and Brighton and Hove. Sometimes those areas are called places. So you might come across the word place. That is another word for West Sussex. So NHS Sussex works to improve health and wellbeing of Sussex population by leading design and improvement across health and care system and driving collaboration with integration across partners, which is really the key bit in terms of coming into what the Integrated Care Partnership is, or the ICP. So back in 2022, Sussex Health and Care Assembly was formed, and it is a joint committee. It brings together the NHS in terms of the Integrated Care Board, but all of the upper tier local authorities, but also universities. We've got our VCSE in there, Health Watch, and then further education, so housing local enterprise across the whole of Sussex. The Health and Care Assembly worked together to draw up improving lives together. So when you get the presentation, that's an enabled link, so it takes you to the document, which is our overarching strategy for the Sussex Integrated Care System. Suddenly we've got an ICS come in, that is the ICB and this health and so the Sussex Health and Care Assembly working together. Essentially, the ICS is the whole of Sussex, all of our services that are involved in health and social care coming together. And this strategy brings together our priorities over the next 5 years. And also it then builds on those existing place strategies. So when I was talking about West Sussex, and what I've done is enabled the link for the executive summary of the health and wellbeing strategy for West Sussex. I know that sounds really complicated, but it is trying to say we're all trying to draw together. So rather than everyone having their own strategies, their own focus, it's recognizing the difference at place, but trying to bring it all together into a coherent approach going forwards. Okay. So into the bit more into the Sussex, into the carer data. From the census, we're looking at the West Sussex of 8.7% of residents have declared themselves as unpaid carers. They recognised, they reported that they are. Interesting, so carers allowance for West Sussex, it's looking at 11,845 people. And then in terms of the GP care registrations, 7,858. Now, I think probably all of us in this room, working carers, will think that's probably underrepresented number. It probably, the actual situation isn't there. And I think that's a lot around the fact that people don't recognise themselves as carers. You know that, I know that. When I was working before this job, I was working at St Catherine's Hospice, and when people were saying, we were trying to identify carers, we were saying, you know, what's your role? They were like, no, I'm wife, I'm a husband, I'm a daughter. And we were trying to recognise that huge role that they take on as a carer, and recognising it and giving themselves confidence to say they're a carer, as well as remaining the husband, the daughter, the wife. In terms of why carers are important to the ICS, and so when I'm using ICS, I'm doing that really broadly to say that it is about our local authority care colleagues, it's everybody. Is that actually, so yes, carers are our patients too. They're our residents in terms of they're living everywhere in West Sussex. Carers are essential for supporting people to live and stay safely at home, come from home from hospital safely. Carers are members of staff. We're probably in this room, a number of us will be carers. And we know that caring impacts on health and wellbeing. So in terms of impacting on NHS services and impacting on county council services, and also caring impacts on ability to work. So impacts on about benefit uptake, about the economy. It's everywhere. Carers need to be seen, they need to be recognised, identified and supported. Looking at what NHS Sussex is doing, and also in partnership with our county council, this will be the next section of the presentation. So we're going to look at looking at the carer support contracts, how we can increase care identification and support, how we gather insight from carers, and how do we involve carers in planning our services. So our core contracts across the whole of Sussex, each of the local authorities will have carer support contracts. These are jointly funded by the NHS and local authorities. I'm sure you're all very aware about Carer Support West Sussex, but the main areas of responsibility include care assessment, the provision of advice and support and guidance. There is respite care. I'm not sure actually that there's. I was just thinking about that's not actually Carer Support West Sussex, but there's care and respite services, access to grants, health and wellbeing grants for carers, provision of peer support, workshop activities, and also the ability to have the voice of the carer, to represent the voice, to have so that they are heard. Increasing carer identification and support. There was additional funding provided for this area with our carer support organisations, really to level up the support across Sussex for this area. So in West Sussex, the focus has been on primary care, and Anna's been leading on this area with West Sussex Carer Support, working directly with primary care to support increased knowledge and care awareness amongst clinical and non-clinical staff, really driving that number of identifying and registering carers, referring carers to the support organisation, and also identifying practice carer leads and providing training. And I think your action learning set and all of the things that have been happening, I believe, is where that's going. And also really making sure that we're not just identifying carers, but actually then offering the support. So not just putting people on a list, making sure that they are actually getting the support and understanding what they are eligible for. In Brighton and Hove and East, where the increase in care identification and support focus has been is actually in the hospitals. So supporting the increased knowledge and awareness across hospital services of carer support, and training for ward staff on carers' rights to be involved in discharge planning, and encouraging early involvement of carers in the discharge. Actually, from the point they come in, from the moment they come in, is actually working with the carers to look at what will be needed at home. How are we going to support people to then go home and stay at home safely? Didn't go. Again, working with our carer support organisations, it's about gathering insight on carers' insight. We've got insight from the VCSE partners surveys and also local authority insight about what's important to carers. It's really important that we listen and we understand so that we can actually design and shape and improve services, that we understand what those barriers to care are and how to remove them, understanding of what carers need. Let me just do this is someone else's slide, sorry. Understanding of what carers need to be able to navigate what is an incredibly complex system, and also knowing what carers need to keep themselves healthy and well. We're very aware that in terms of diverse carers, about understanding how we can actually make sure that all of our services that we deliver and have are actually equitable and able to be accessed by everybody, irrespective of the background of the carer, and making sure that we provide the right information and the right support in the right way. And I think additional work has to be done. I saw some surveys from the GP survey from, I think, a couple of years ago, and it was about the number of diverse carers from ethnic minorities was significantly lower than from our white British population, really highlighting the fact that we know that there are carers from all backgrounds, but even lower levels of registration. So there's more work to be done. From all that insight work, there are these key recommendations that are here, and we'll send these round. All of this information is actually available on the NHS Insight Bank, which you all can get access to. And what I'll do is, we won't do it now, but I will make sure that information gets sent over as to how you can register so you can actually see these reports. Okay. In terms of carer involvement, really it's vital for NHS Sussex and also for the wider ICS to actually make sure that we have carers involved in shaping what we're putting together, co-designing, co-producing, looking at making sure that actual information of what it's like being a carer is actually at the forefront of future commissioning. So we have there are carer support organisations that we, as you know, we work with, that we make sure, and we can then actually recruit some carers with, lived experience or former carers that actually come in and give it their critical friends, their real challenge, but also really change those services. And they've recently been involved with dermatology and also life after stroke and wound care redesign. Okay, so in terms of the so what question. I always like a so what question. So we've said it's really important to identify and support carers, but in terms of what does that actually do to the health and care system, it means that we have more efficient and effective patient care. We know that the carers are the experts in their loved ones' conditions. We know that. If we understand the issues facing carers, we will increase attendance at appointments, but also that they will actually look after their own health so that they can continue to care. And making sure we're looking at the role of the carer as they become a pharmacist themselves. They are the people. It's about supporting carers so that they can support their loved ones at home in terms of taking medication, prescribed exercise, health monitoring. Lots of people would not be able to do that without their carer, and it means that people can stay at home, which supports the pressure in the health service. And generally also keeping carers well and healthy. I know we're going to hear from the carers health team, which is vital. But there are some staggering statistics. I haven't got them in there about how much money carers save the NHS. We need to look after this precious resource. Just a bit of background. It's a very busy slide, this one. It is interesting that all of the carer support organisations and the local authority carer leads all come together on a quarterly basis. Their Carer Health Forum, and actually they continue to complete the Carer Maturity Matrix, which is like a quality improvement tool in terms of how all of the organisations are working together. We look at where we need to improve, we look at opportunities, and in fact a lot of progress has been made over the last few years in terms of a system-wide support of the carer support organisations. And in terms of the future, the commitment to carers is development of a Sussex health and care system, an actual proper charter commitment to carers, and development of a carer programme. We were looking into this, and it's very much about the fact that it will be a defined programme that will be reported on. It will have its own clear governance line. It will have a chief officer and also clinical and operational leads and that. And also we will be sharing the learning from the place-based working to roll out across Sussex. So the work that has been done with the in primary care will be shared with East Sussex and Brighton and Hove, and the work that they've been doing in the hospitals will be shared with West Sussex, with the aim of looking at best practice, what's worked, how we can do this across the whole of Sussex. And just to say, it's recognised the vital importance of primary care involvement from the carer leads, social prescribers, health and wellbeing coaches, care coordinators, that you can support people to support your patients to recognise that they are carers, to give them the confidence to identify themselves and to accept support, and also to make sure that they are heard and included in their decisions about their loved ones. And that's me done, and it's slightly longer, sorry, Anna, than I said I'd be.
Thank you, Liz. Does anybody have any questions for Liz? Yes, Freddie?
Hello, Liz. Hello. Thanks for that. You've cleared up a lot of abbreviations, which I'm getting bogged down with and confused with at the moment, so that was really helpful. I was just wondering if the Carer Health Forums was something that was open to other organisations to attend, or whether that was invite only.
Interestingly, it's not. It is very much about the commission services that all come together. That's as far as I know. Whether there's any plans in the future with the commitment to carers is something that we can feed back, but it is very much the commissioners, so the NHS Sussex and the local authority coming together with all the different organisations across Sussex. But it's something we can certainly take back and say, is there a wider network that people could be involved with?
Yeah. I'm sure the information's being disseminated down from those meetings anyway, but it just sounds like a interesting one to be involved with. We haven't got a carers lead for our team, but it's something we could identify if that was a need. Obviously, we're supporting a lot of carers within social prescribing. So the other thing was I was speaking to a colleague the other day, and I don't know what it was called, but he was talking about within primary care, a carer is able to get their voice recorded in some way on the patient record, and I don't know what it was called. But I was just wondering whether anyone on the call was aware of something like that. No. Interesting. Okay.
With that one, Freddie, she's not on the call today, but there's a digital lead for a primary care network that is, well, I really rate her and her expertise. So I can take that question to her and come back to you. So did you say they can do a voice recording onto their patient record?
Not necessarily a voice recording. No, it's sitting down with a clinician or a health professional, or I'm thinking a social prescriber, where we can get it in writing what the carer feels they need to support the person they are supporting, and have that on their record. It was something perhaps they're doing in Tangmere.
Okay.
By the sounds
Chrissy's not on the call today, but I'll ask Chrissy. I'll ask Chrissy and come back to you all on that one. And I'll do the same with Megan, because we'll just see. Oh, and then the pen runs out. Yeah, okay.
Thank you.
Thank you. Anybody else got any questions for Liz?
I don't know if you've seen in the chat, but Kirsty from Cathedral Medical Group, thanks Kirsty for your input.
Thanks,
She's made a little comment here about uploading uploading onto
Using
the patient file using the digital phone
yeah.
system. So that's quite useful.
Okay. The only other thing I wanted to draw your attention to in Liz's presentation is that she actually used some hot off the press Carers Weeks. This every year, Carers UK do a YouGov poll. This year it's actually over 10,000 people that were polled, and then they draw out the findings from that, and that's where some of those infographics within Liz's presentation have come from. I'm just going to drop into the chat the link for people to use, because in terms of your own learning, or just some of the kind of key highlights, just even if you just read the executive summary, it's got some it's just, it makes a good read, but it also shows that this is possibly a worsening scenario in terms of how people's care responsibilities are increasing. They're caring for more hours, the natural implications of that on their own health and well-being, and therefore what that means for us all in terms of that early identification and support, just to ensure that the impact, or the negative impact of caring, can be kind of warded off as much as possible by those early infrastructure and early support systems being in place. So I popped that into the chat, and now I'm going to hand over to Addy and mute myself. If anyone does have any other thoughts or questions they would like to ask Liz, pop them in the chat, or I'm sure I will happily pass on any other messages to Jane or to Liz after today if they come to your mind. So in the meantime, over to Addy. And Addy, once again, you're happy to share your own. Yep, great. So I'll mute myself.
Good morning, everybody. My talk actually follows on very nicely from Liz's, and some of the figures, I did notice some of Liz's figures were much more up to date than mine, so apologies for that before they even get there. They were certainly hot off the press, and mine are a little bit dated, but I'll share them with you anyway. So we've got the PowerPoint. Oh, you don't. Hopefully everybody can see that. Just let me know if you can't. So we're the Carers Health team. And what we do, so we're a small NHS team, part of the Sussex Community Foundation Trust, and we're commissioned by West Sussex County Council. We're a non-urgent and short-term service, and we've got, our team is registered nurses, OTs, physios, and we've got an admin coordinator and an administrator, and there are 13 of us in total, 10 clinicians in total, and we support informal carers across the West Sussex. So we're only in West Sussex, we're not in East Sussex or Brighton and Hove. So we were launched in September 2013 to address the needs of adult carers within West Sussex. And although we were initially tasked with improving the general health and resilience for over a short period of 4 to 6 weeks, we have always offered that longer term support if we need it to those who are most vulnerable. So we do sort of stay longer if we need to, and we are responsible for sort of the prevention of many a breakdown or carer crisis by just us going in there and seeing people. And we see over 1,000 carers a year in West Sussex. So there was something about the cost. So this is one of the costs. This is a little bit dated in terms of where I got the figures from, but possibly the carers health team by supporting carers, support about £2 million, save in excess of 2 million per year, just by taking the pressure off other services. So it's quite a significant amount. So that's a picture of the team. Only one person missing, but most of us were there. And the aim of service, so what I said is to improve the health and being of the carers and the people that they care for as well. To work directly with carers to promote the importance of looking after their own health and well-being alongside their caring role, and to develop individual strategies with the aim of reducing the strain of coping with their caring role, offering practical advice and information. So, the primary focus is to deliver a service working directly with the carers in conjunction with the person who is being cared for. We're working proactively to ensure they're considering their own health. Looking at the needs of the carer and the cared for person, ensuring that they have additional knowledge about the cared for's condition, so supporting them to learn about that condition if they need that extra support, and putting them on the right care pathway so they achieve the best quality of life for both the carer and the cared for. Any relief for any symptoms for the cared for, and they're getting proactive support about choices and advanced care planning and the management of those conditions and caring situations. And we're working very much in partnership with other teams. So we're working with our GPs and our proactive care teams and our community response teams, because collaboration for the carers health team, collaboration is the key. We're getting other services in, we're working with carer support, we're working with Tuvida, Age UK, dementia services. So it's really about that MDT working. The referral process. So to be referred, they must be over 18 years old and registered with a West Sussex GP. And we need consent from the carer to refer into us, because we have access to their medical records. So they need to be aware of that, and it needs to be documented on the referral form. Anyone can make a referral, so people can self-refer. So you can just give them a leaflet and they can ring in themselves or email us. Once we've received the referral, it probably takes us up to 3 weeks to contact that person. It's generally quicker than that. So we do usually get hold of people much sooner than the 3 weeks, but it's three weeks, within 3 weeks. And then we aim to do a home visit within 4 to 6 weeks. Again, that's our sort of parameters for visits, but it's usually quicker than that. So often we'll see people within a couple of weeks, but definitely within 4 to 6 weeks of that initial contact. For the assessment, the carers are usually seen in their own homes. We have got a few options in terms of, there's a few carer clinics that we run, and we can get rooms within the trust, but they're not actually always that easy to get hold of. Some GP surgeries let us use their rooms in their bases, so that's quite useful as well. But ideally, we see people in their homes to get a full picture of what's going on with them. In terms of interventions, our clinicians work in partnership, as I just said, with carers to develop personalised care plans, and if needed, for the person that they're looking after. And then we will review what we're doing with them. So we'll agree goals, follow up on any interventions, and plan for self-management with the understanding that they can be referred back into at any point. So although we're short term, people do come in and out of our service quite frequently. The referral form, this is just a snippet of it, of some of the things we need on it. So we definitely need the person's name and date of birth as essential. We also need the GP surgery just to check that whether they are within West Sussex. We need to know that their consent to the referral and consent for us to look at their medical records. And it's good to get a brief rationale for why you're referring someone in. So it doesn't need to be a huge amount of information, but it's ideal if we can just get a little bit of information about what's going on, and also a little bit of information about what's going on for the cared for. Again, we don't need huge amounts of information, but if we've got a bit of an idea of what we're going into, that's always better. I can send out referral forms to anybody who needs them. Who refers to us? So we have last year we had, from 23 to 24, we had 1,594 referrals in total. Out of those, the biggest referrer to us is actually Carer Support, who sent us 574 referrals. So we really do work in partnership with Carer Support. We had 262 self-referrals. Now, that's not just new people, that's people referring back into our service who've previously been seen by us. So they do account for a good number of people. We also get quite a lot of referrals from proactive care, because we work quite closely with the GP surgeries, and we attend a lot of MDT meetings at the GP surgeries. And then the rest are sort of splattered around other services, as you can see on there. What we do and how we do it. So the service is proactive. We're looking at health promotion. We're also looking at contingency planning. So what happens if something happens to the carer? What are we going to do with the cared for person? And that's really often plays heavily on the carer's mind, is what there can be older people. What happens if something happens to me? So we discuss those things, and we do have a good sort of idea about contingency planning. We're signposting, we're referring to other services, and we're liaising with our partner agencies. That can be NHS, social, voluntary and charitable organisations. We provide advice and support about issues such as healthy eating, health conditions, medication, continence, falls and basic manual handling. We assess wellbeing and refer to appropriate services for mental health support, including bereavement support and counselling if needed. We see carers in their own home to complete a comprehensive assessment. Now, I think we're quite lucky in that we have the luxury of time within our service, and we'll quite often spend an hour or 2 hours with the carer discussing what's going on and what their situation is, which is, quite, like I say, a luxury in this day and age. We also carry out carer clinics in a couple of the GP surgeries. So we've got them in Arundel, one in Leecroft in Crawley, one in Limetree in Worthing. And we've just started a new clinic at Sage House at Tangmere. But we can have appointments, like I said, away from the carer's home if needed. We do attend various events and groups to promote our service where we can. And we also work closely with other support organisations. So just to give a bit of an overview of what our assessment would look like in terms of health, there's a list, and we're looking everything from emotional health down to sort of allergies and everything in between. And then we've got a RAG rating. So the clinician will go in and discuss any of those relevant conditions with the carer, and they'll rate them. The RAG rating for those that don't know, it would be looking at, say, something like blood pressure. Now, if they had high blood pressure, but it was managed with medication and it was in normal parameters, then they would be agreed, no issues. If they had high blood pressure, but they were on medication, but it was not quite being managed, they might be amber. If they had high blood pressure, which with no intervention and they hadn't seen a GP in a while, then they would be red. So we would go through everything and sort of rate their health issues accordingly as part of our health assessment. And then we'd create a care plan with the person that we're supporting, which would include this contingency planning and agreed sort of plan for what was going forward. For example, we might refer to Tuvida's emergency respite, or social care for respite might be part of the plan. So there's the facts and figures. Slightly more outdated than Lizzie's, I'm afraid, but yeah, so obviously caring can have a significant impact on health and well-being, with 60% of carers reporting a long-term health condition or disability, compared with 50% of non-carers. More than three quarters of all carers feel stressed or anxious, half feel depressed and half feel lonely. There is increasing evidence that caring should be considered a social determinant of health. And the impact of caring on employment: on average 600 people a day, which is just a vast amount, leave work to care for someone, with over 500,000 people leaving work to provide unpaid care that was pre-pandemic. So it's probably higher than that since the pandemic. 75% of carers in employment worry about continuing to juggle work and care. And 1 in 3 NHS staff are unpaid carers, which again is a vast amount. And between 2010 and 2020, more than 1.9 million people in paid employment became unpaid carers every year. So that, again, I was referring to the State of Caring report in 2023, which did sort of show there was a lack of support and recognition from health and care services, which was severely damaging unpaid carers' mental health. It highlighted how people can be caring around the clock for older, disabled or seriously ill relatives without adequate support from statutory services, leaving many of them steeped in thoughts of hopelessness, fear, dread, and in urgent need of support. Again, yeah. And again, Liz mentioned about the underrepresented groups. So we are trying to reach out as carer support. We're working particularly in sort of the Crawley area with our partnership agencies to try and reach those under-supported groups. But some of the impact is that Black, Asian and ethnic minority carers are more likely to be struggling financially. At the beginning of the pandemic, over half of unpaid carers from Black, Asian and minority ethnic groups said they were worried about their finances, compared to 37% of white carers. LGBT carers were more likely to feel lonely. 48% of bisexual carers, 45% of lesbian and gay carers often or always felt lonely, compared with 33% of heterosexual carers. And 27% of carers who completed the State of Caring survey in 2022 said they had a disability. So it is an area where we're still working on to sort of reach those carers. Unpaid carers in England and Wales contribute a staggering 445 million to the economy every day, and that's 162 billion per year. So the value of unpaid care is equivalent to a second NHS in England and Wales, which in 2020 and 21 received an estimated 164 billion in funded. So, you know, again, it's as Liz was saying, the impact of the amount that they're saving the economy with their caring role is just staggering. So again, the impact of caring. Many carers neglect their own health and well-being to look after the person they care for. They experience loneliness because of their caring role. The cost of caring, you know, impacts on them financially, especially during a cost of living crisis. It impacts on their manual handling, personal care. You know, manual handling personal care can impact on their physical health. Juggling work and caring increases stress and, you know, the mental health, and they often worry about the future. So we're, as a carers health team, we're there to support them with those things in the little triangles. So we're there to talk to them about their physical and mental well-being. We're talking to them about giving themselves time to look after themselves. And sometimes that's about hearing that they've got permission to do that, because people feel that they don't want to look after their own health and well-being, and that they feel guilty for taking time away from their caring duty. But we can sort of stress the importance of having time for yourself. We can signpost them to people who can support them in terms of managing their, again, that's usually back to carer support, in looking at their finances and checking they're on the benefits that they should be, how they're managing at home and how they're managing at work. And again, it's just taking that time to discuss how they feel about caring and how it's impacting on them. So we do, like I say, do spend a lot of time talking through all those points with the carer. Any questions? Come out.
Do you want to go for
whistle,
it,
whistle stop
Yeah.
tour of what
No.
we do.
Yeah.
Freddie first, and then
No.
Mike.
Thank you, Addy. Firstly, I thought that was really impressive that in the current landscape that you're still managing to turn things around so quickly with referrals. 3 weeks to me sounds quite exceptional, and 4 to 6 weeks for a home visit. So yeah, that's really impressive and good to hear. So I had a few questions. I was interested in the clinics. So you talked about 2 that are local to us in Chichester, Sage House and Arundel. What happens in those clinics? What do they look like?
So the clinics are, I mean, it's because we're such a small team, we can't do it with every GP surgery, and obviously that would be great, but we can't. So they're sort of the Arundel one is definitely a historical one, because Arundel is a bit on a limb in terms of, you know, some of the services.
Boundaries.
So one of our clinicians just has one day a month where the GP surgery can book in any carers to see that clinician. So they'll just say, if they come across a carer that needs extra support and doesn't want to be referred, they can see them at the GP surgery and they'll book that in. And then Sage House is just very new. We've literally started that in May. So again, at the moment, it's just once a month, 1 day a week, where someone going into Sage House can book in to see our clinician about their health needs. So
Nice.
that might increase to more, you know, twice a month if it's well utilised. But at the moment, like I say, it's only just started, so it's early days.
So would that be open to patients registered in other surgeries, or is it just those 2 surgeries at the moment?
With Sage House, obviously, they have to be someone with dementia, so that's the criteria for there. But I think you could probably, other places could possibly utilise that space and just say, we've got ringing up Sage House and say, can we book someone in for your clinic with Carers Health Team?
Yeah,
So
and the one in Arundel is quite broadly just anyone in a caring role.
Yeah, but obviously they need to be registered with that GP in Arundel.
Oh, they would.
I think they would need to be
okay.
registered within, because I don't think they'd want other patients coming into their GP surgery. But most people, you know, the majority of people are happy to be seen at home. They can usually sort of find a bit of space away from their carers, or sometimes having the conversation in front of the cared for can be quite productive as well. So it's not always negative to be talking about the cared for while they're in the room. It's a 3-way conversation about what they do, and sometimes the cared for is also saying, yes, you need a break, you need to come to have some time away from me.
Yeah, it can be helpful.
Yeah.
I have other questions, but I think Claudia's got something to say possibly on that. No, sure? You're not going to forget it. All right. Okay. The other thing was, you talked about a carer plan. I was wondering who that was shared with, because that is kind of what I was asking in my last question. Is that on the GP record?
Yeah, so we use System 1, so it's all saved on System 1. But as usual with System 1, it's all about sharing permissions, isn't it? So we will always tick that, you know, once we've had the conversation with the carer, if they're happy for our records to be shared, that's fine. But I've got a feeling it always comes from the GP surgery, so it gets their permission sharing. So it's complicated with System 1, but it's definitely on there. And if they've given permission for all their records to be shared via their GP surgery, it would be on for everybody to see.
It sounds like quite an important document.
Yeah.
Yeah.
Freddie, are you, so there are, just on this again, because there's a carer contingency plan, which is one thing. There's a carer's health plan, which, so Addy works around, they were talking about a carer plan. And then some of our surgery, so we know Tangmere do an annual review, we know Furnace Green do an annual health check. So there are different versions of that. And then at Carer Support West Sussex, we do a statutory carers assessment, which is similar but different. So it looks at their overall needs, not specifically their health needs. So and all of those things in terms of what the NHS England system expects of a GP surgery is that they code the patient appropriately as a carer, and they link that record to the person with care needs, and they record whether or not there is a contingency plan in place. But they don't actually have to record the contingency plan on the system. That's what the system expectation is. So I'm just wondering, because there are a few things that are very similar, that could be what you're referring to. Yeah. So and we could show you we could share with you some examples of what that might look like, but they're all slightly different versions of and they have they're different for a reason, because one of them is specifically focused around social care and the needs of the carer individually. And obviously there are those other health, you know, in the same way as an over 65 might get an annual health check. There are some that are more targeted toward carers, and there are others which are an annual conversation, so more like a conversation-based review. So they are slightly different, but you know, we could talk, perhaps it would be useful to look at what those three different examples are.
Definitely.
Yeah.
Okay. On System 1, there's now something called All About Me. Are you aware of that?
So I'm not aware of that one.
Yeah.
No, yeah.
So there's an All About Me document, which if there's any additional needs, so that would come into the carers if they had a, you know, hearing loss, sight problems, all those things would be documented, so that is definitely on the shared record. So we would be putting that All About Me that they are a carer, so it should be coming across the board on all the GP's notes as well.
Yeah, and actually, Freddie, I'll share with you after this section, but System 1 and EMIS have both got a mechanism in which to flag, they're different, but have a mechanism by which to flag that the individual is a carer, so that it comes up as an active concern, which means that it will always be on the summary record of the patient, so that allows, in the same way as Addy is saying, if they look into the record, they can see perhaps that they're a carer and the About Me section. But it's how we make sure that everyone within the primary care setting, or in fact the secondary care setting, can see that the individual is either a patient with a unpaid carer or a carer themselves who may have someone with care needs elsewhere. So I'll show you. Yeah.
The All About Me creates the flag.
Oh, does it? Oh, great. Okay. Yeah, that's good.
Yeah, that's really
helpful.
Is that
new, Addy?
Yeah, it newish. It's been in there a few months, but
yeah. Oh, I'd like to chat with you about that, because we've chatted, obviously, as part of all of the things we've developed. We chatted with both System 1 providers and EMIS providers about the different ways to flag as an active concern, but I don't know about that mechanism, so I'd appreciate picking that chat up with you separately.
Yeah.
I'm just going to, Mike, I know you had a question, and then Claudia, go for it, Mike.
It was just talking about the emergency planning, contingency planning, and one of the questions that we asked from anyone who's had the baseline review, that's one of the things that we look at. And I've sort of mentioned in the past recently about referring to yourselves to the carers health team. Some of the surgeries said they haven't sort of referred to you or haven't had sort of much contact. Are you happy for me to put a link into our summary that
yeah, of course, yeah,
we
definitely,
sent? Because
definitely.
I know, as you know, someone that works for carer support, sort of how valuable it is and how thorough you are sort of with the health checks, and what an important service it is. So just say thank you.
No, thank you. Thank you. That's lovely.
Claudia?
I just wanted to say, Addie, that I refer one of the people that I referred to recently when I saw them last. They showed me what work your team had done with them, and I couldn't believe the amount of work. I was so impressed and so grateful because it had been life-changing. It had been very broad and holistic, and it had been life-changing for this person.
Thank you. Yeah, I mean, I think that is the beauty of the team. Like I said, we have got the time where other services just don't have the time. We can stay with someone for a couple of hours. We can call them back the following week. We can follow up on all the things that we do. It is amazing what the clinicians do when they're out there. So thank you. I shall feed that back to them.
And Freddie, because Freddie and I were discussing the question he'd asked about how people can be recorded on the system. Freddie, I think that All About Me is what that person was talking about.
Yeah, that's right. But Jeanette's already said that she can't find it anywhere on System 1. So I don't know if that's a PCN by PCN kind of thing.
Okay.
I'll definitely follow up on that because we've also Jeanette said she can't find it on System 1 as well. So I'll definitely follow up on this and I'll share the information because we're interested in obviously from our point of view as well. So I'll check this one out and see what the accessibility is and how people can connect to that information. I'll share information with the group. And I just want to reflect back that part of the reason we invited Addie today is because I just think in terms of a resource that can add capacity within to all primary care settings, I just, when I look at the referral sources, I think it's obviously they've got a great amount of referrals and they're doing incredible work, but it surprised me that such a large proportion came from us rather than from the GP surgeries themselves when they can add, they've got clinical representation as part of their cohort of professionals. They're able to go into carers' homes, which adds that added flexibility around accessibility to support, and they offer such a stellar service. And they're very rare. They're like gold dust. They're not available in many places as far as I can see across the country. So I just think that's why we wanted to invite them here today, just so that you could be aware of how they can add capacity to your services in terms of how you're able to support carers, and in terms of your own carers offer, how you can connect them and refer into Addie's service. Addie?
Yes, because one of the things that Liz brought up is about finding the carers that are not receiving anything, and by the nature of carer support referring into us, they've already been seen by carer support, so they've already got some contact with something going on there. So actually, we are really trying to work with urgent community response services in particular, but all the other NHS people out there to sort of say, actually, we need to find them before they get to carer support. We need to be referring them to carer support and doing it the other way round, so that we're finding those people who've got nothing at the moment. So GP surgeries are sort of integral to that.
Okay, thank you very much for your time today, Addie. We've got about 15 minutes left of the session. I just wanted to take the opportunity to flag a couple of things that we've recently launched as part of this primary care engagement project with you. So I am going to share my screen because I'd like to show you the internet. I won't be able to see any of you guys, so if someone can holler if they can't see my screen. Caroline, if you can holler. Oh, I can actually see you, Addie. Can you tell? Oh, wait a minute, Claudia. Sorry, Claudia, I missed you there. Do you want to? I can't unmute. If you can unmute yourself, feel free to ask a question.
Sorry, I don't know why my hand was up.
Oh, is it
Wasn't
just still raised?
speaking.
Okay, great. Can
Yeah,
everybody
we
see
can
my
see that.
Yeah,
can see
brilliant.
that, Anna.
Thanks,
Yeah.
Caroline. I'm going to drop this link into the chat, but this is just to let you know that this is, you can see at the top here, this is Carer Support's dedicated primary care page now. So for all, principally for carers leads within any primary care setting, but I think social prescribers will find some of the resources here very useful as well. So this is our landing page now, and you'll see it's got the toolkit around identifying and supporting carers in primary care, which I will click through in a second. I think I just received an email from, I didn't see who it was from, but asking me where they can see the previous carer learning set. So every time we have a carer learning set, we will upload all of the learning materials onto this particular page. So the ones we've had so far are caring with cancer, carer awareness general, young carers, carer benefits, and we will add today's overview session as well from Carers Health Team and NHS Sussex. So that always has the recording from each of the previous sessions. I think I was just asked actually about the presentation material as well. So I'll look to putting up the presentations onto this page also. And the other areas of particular interest will be the information for the Carers Lead Network, and Caroline and Mike, they individually meet with each of the primary care settings across West Sussex. I think we've done about 26 now, around that amount, and we'll look at what you're currently doing to help identify and support carers, and we'll work with you. So it's very informal. It's a relaxed conversation. It is about just acknowledging what capacity you have and what interest you have, but we'll work with you to make as many of the materials and resources we've built available to you, an action plan with you on some of the steps that you could take forward to improve that identification and support. And so far, we've had excellent feedback actually on all of those meetings. And in every instance, even if it's been a small thing, every single person that we've engaged with so far has wanted to and has implemented either big or small actions that have made significant changes for them in their GP setting. I just wanted, as part of this, to show you our toolkit. So what this has on here is the background information. We do need to update some of this with new stats as they all the time as they come on board, but this is the who are carers and why should you support them. So why they need our help, what is required of GP surgeries, that's from the Care Quality Commission and from NHS England, and just the general benefits for GPs and carers. So if you go in each of these, you'll see that it's really about simplifying information. It's not about lots of dense information. It's very, very simple. That's it on a page, and it's just trying to make information as accessible as possible to you guys so that you can do what's needed in your own environment to implement some additional support. And then we've looked at the 6 pillars. So this is what we consider as really good foundation level support for carers in primary care. And once again, we've just tried to make it as simple as possible. So easy accessible language. These are the 6 areas we think would be beneficial. And then what we've done in each of those, for example, is, make information available and accessible to carers. And then we've talked about what that looks like. And we've made all of the information available for you. So here's your digi posters, your young carer leaflets, the young carer posters, Facebook sample text, website sample text, example text message campaign. So that it just makes it as simple as we can make it for you not to have to create all of those materials and resources yourselves, but access them available here. So that's the same in each of these areas. So for example, if you don't yet have a carer's lead, but would like to have a carer's lead, we talk about what that role would look like. We talk about an example role description and what responsibilities would be in there and the top tips. And then we include a carer protocol within that for you. And in all instances here, we've actually tried to utilise what's actually already in the area. So, for example, this one has come from Worthing Medical Group. It is a real example of a carer protocol, and it's something that they have in place. We've provided it in Word so that it can be you can kind of use as much of this information as you would like to yourself. And similarly, if you don't want to use somebody else's, we've created one again in Word. Where you can just insert practice name, look at the information that's in there, delete what you want to delete, keep what you want to keep. So this toolkit is now live. I will send this link to you today. If you have any questions about any part of the toolkit, about wanting to have a chat with us individually, that's what we're here for. So I'll pop that right now into the chat, and that's available for everybody to make use of. If anyone has any questions on that right now, please feel free to ask. Otherwise, I'll move on to the next thing I just wanted to flag with you. Okay, so back on this home page, the other thing I wanted to draw your attention to is that we have launched this week, in fact, our Care Awareness in Primary Care free online training. Now, what this is it's actually a learning, so it's on an LMS system. It's a learning management system, and it's for self-directed individual on-screen learning. It's roughly 30 minutes in its duration. I'll send this link also, gives you the training details, the audience, how you can access it, and it's got the enroll here option available. Now, what we're seeking with this, to be honest, for those of you that come to our Carer Lead Network or Carer Learning Set, a lot of the information that's contained in here will already be, you'll be well versed in it. So this is targeted more at your professional peers. It's the primary care clinical and non-clinical staff that haven't yet necessarily engaged in this activity, practice managers, the receptionists, care coordinators, social prescribers, digital leads. We would love, where possible, for it to be incorporated into mandatory induction training, and we've actually popped it into the West Sussex Primary Care Bulletin this week. Liz very kindly sent it on to the delivery managers to go to the practice managers for their information, and we have sent the information to all carers leads this week as well, in the hope that people will access this training. And we've had wonderful early feedback on it, including from both GPs, practice managers and our carers leads, about how engaging, interactive and informative it is. So we would really invite you to please share this information with your colleagues. When you log onto it, all you have to do, it's not going to let me because it's hiding under my share a screen. Yeah, that's such a shame. It won't. Oh, there. Will it let me? No, it won't let me. Okay. But there is a very simple enrollment. Got everything coming up now. Let's just make you bigger for a second while I stop sharing. It's got a very simple registration page, and you just have to include your information, and then it will send you the course details. Oh, Julia, thank you. I piloted the training and it's excellent. I didn't ask Julia to write that, so thank you very much. We have shared with all staff at the practice and will be included in induction. Oh, wonderful. That's such a nice story for us to hear. Oh, and thanks, Liz. Thanks, everybody. Yes, we do hope that you enjoy it and that you find it informative. The last thing that I would like to share with you, because what I'm conscious of is I'm like one of the chief people that sends you emails, and that does mean that, one, I'm sure I can get annoying, and two, that you can't necessarily read or open them all. So I just want to flag with you this last resource. We sent this a couple of weeks back, but it is still relevant, so I'm going to share it with you today. So we send out these mini campaign packs at key points in the year: Carers Week, Carers Rights Day and vaccination season. We send them to our carer leads. We don't send them currently to social prescribers, but we can do if people think they're useful and helpful for social prescribers. But I just wanted to flag that obviously it is Carers Week. We are only on Wednesday. There is still 3 days, including today, left to take action this particular week. But also some of these resources can be used over the next couple of weeks as you do follow-up action from Carers Week. So it's a very, it's not short, it's 9 pages, but it is there 9 pages because it's full of some very simple resources and materials for you. And also each of these are live links. So if you only have interest in a particular part of this, then just live link to those. So for example, here I've live linked to the Carers Week website because they've got some fabulous posters, which will it allow me to show you right now? It may not allow me to show you that right now, typically, or is it just taking a while? Here we go. So these are Carers Week posters. They design new ones every year. They're wonderful. Think about putting them up on your notice board or your digiboards. They show a wide demography. We've been talking about different demography, age groups. A lot of people don't think of children as carers. So I've linked to those on that document. Please think about using them this week. An example email for your staff. So again, this is just something you can copy and paste, but it gives information on what Carers Week is, and it suggests that your staff look out for carers and think about how to invite them to register with you. There's example Facebook posts, so I'll just link through to that. All you have to do is copy and paste it, and it also gives you the images that you could use to put those up. So if you're not the person, you could think about who within your organisation might find that interesting. It's got links to the wider Carer Support West Sussex events that are being held. It's got the staff, because, you know, even just if what you want to do is actually pop up a poster for your staff into your internal, your staff room, just so that we can actually understand internally who carers may be, to be able to look out, and that's got some of the coding information there as well. So every kind of key points in the year, we provide this mini campaign pack just to put all of the information there available for you. I'd invite you, I will add this to the chat, the document, but I would invite you to just glance through it, think about it, you know, the posters, the comms elements to it, and those wider asks that might be useful for you to share with your professional peers. Okay. Well, that brings us to 5 minutes before social. It would definitely be useful to send. Okay, grand. I will do that in that case. I will send them in the future to you guys as well. I will add it to the chat for today, the documents. I need to figure out how to do that, so I won't do that right now. Has anybody got any other questions for myself or any of the speakers today? Brilliant. All right.
Just
well,
a statement really to say
yep.
how brilliant and useful this has been. So thank you for organising it.
Oh, that's a pleasure, and thank you for saying that. I appreciate it. And do tell your friends. We do usually get another 10 people, around 35 to these, but I do think for an hour's worth, you do get an hour's commitment of time. You do actually get quite a lot of information. What I've done is I'm going to launch the poll in a moment. We do use those polls to show for ourselves as a learning of what resources you find useful, what useful future topics we could include in these sessions. So please do take the time to fill out the poll. It also helps us just you know, kind of show evidence that these sessions are useful and helpful. So I will launch that. I always get nervous at this point. We haven't, normally we do add more, because we haven't done a specific learning set today. We haven't actually asked some of the standard questions we would normally ask, but still it would be useful for us if you would take the final 4 minutes of today's session just to populate that for us. And otherwise, we look forward to seeing you again in the future. Please do get in touch with us independently if you would like a one-to-one session with Mike and Caroline. Oh, sorry, Addy. Yeah, go for it. Oh, you're on silent still, Addy.
Do you want me to quickly share the All About Me where it is on System 1?
Oh, yes, please.
I've got a
Yeah,
test patient up.
Yeah, that'd be great. Yeah.
Hopefully you can see that. So it's just down the scroll bar. It's there. And as you can see from this one. And it comes up like this. So you've just got carer status is the bit. Patient providing care. And it's got other carer of other. So then by ticking that, that flags it, which should flag it as them as a carer. And then you've got other protected characteristics, disabilities. So we do that. We should be doing that on every our team should be doing that on every patient they see. So they put that carer status in. Can you see that?
Yeah.
Yeah. And then that flags them.
Amelia, so Amelia's saying they don't have that particular access to that. So I think that is really helpful. And I'm not entirely sure who I would raise that question with, but I will raise that. I'll find out, and I will raise that question about you know, what actually is required to gain access to that part of System 1, and if it's something it might, because there must be on the universal. I'll figure it out about the how that's available on the template, and have some conversations, and I will definitely. But that's brilliant seeing where it is. Thank you, Adele, and thank you, Amelia, for feeding that back so quickly as well.